This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. A staffing matrix is a tool that aids in comprehending the levels of all staff groups required in a consensus-based hospital setup. Nurses utilize the staffing matrix as guidance for making adjustments based on the insight and demands of the patient. A staffing matrix is critical in a healthcare context and vital to resource allocation. Staffing matrices have been quite beneficial in many healthcare units, ensuring no ambiguity or duplication of resources. The reflection discusses the staffing matrix in detail and indicates how many full-time equivalents, FTEs, should be assigned to the daily routine on the staffing board. As a result, it clarifies the units of service users and all financial management and allocation legislation. This gives the health unit a comprehensive picture of human resource management and the unit's overall development. The staffing matrix assists the company in avoiding resource duplication and ensures effective resource and human resource allocation. The reflection on the staffing matrix establishes and aids in the organization's daily routine assignment. It creates a consistent work schedule and assigns appropriate duties and functions to individuals working in healthcare. It establishes the amount of finance available to each department, ensuring that there is no overage or wastage of cash. It has demonstrated an exceptional ability to perform this function and has improved the company's results. According to Riley et al., all financial principles are used to better understand the various financial allocations to different sectors. The healthcare workforce will not grumble, as finances and resources will have been distributed appropriately. The matrix contributes to an increase in the quality of patient care by ensuring that nurses provide superior service due to properly assigned duties. The matrix fosters collaboration among members, resulting in the increased achievement of objectives. Healthcare is a team effort. Description of our staffing matrix. The staffing matrix within our healthcare setting staff 20 nurses, 2 of whom will serve as 3 health coordinators, 5 nurse aides, NA, and 12 registered nurses. The staff members work 3 shifts, with 3 nurses in charge of daytime responsibilities. The 3 nurses will complete the assignment on 3 consecutive days before turning it over to another trio. Week after week, the cycle repeats itself. Because the needs and risks are more significant at night, 5 nurses will work 3 consecutive days in shifts. Increasing the number of nurses available at night reduces the workload and demand. Additionally, the additional nurses will decrease the likelihood of work being borne out, ensuring that the patient receives the best possible care. The team appears balanced, and tasks are carried out well. The nursing team will provide some positive results after deploying this new staffing strategy. Furthermore, the quality of treatment offered is predicted to improve as nurses can devote sufficient time to each patient's condition. The mathematical expectation is that the patient's risk of death will decrease by 25% due to improved collaboration. Additionally, there is a possibility of receiving no remuneration because the work is done flawlessly and without any issues that may develop following completion. The nurse's enthusiasm and a well-planned timetable will ensure that they work on time, resulting in on-time delivery. Staff perceptions of their workload should also improve as required objectives are met. Most certainly, opinion will improve by 15%, which is a significant improvement. Consequently, the budget is likely to improve, resulting in significant cost savings. This demonstrates that the staff as a whole is being developed and improved. Medical errors will also decrease as a result of enhanced access to patient data by healthcare providers, which will result in the transmission of error prevention signals. The automated coding capacity will be expanded, and the documentation will make it simple to keep patient information secure and accessible. Moreover, it will benefit the surrounding community and the patients, as they will receive the highest quality care. Moreover, because patient pleasure and safety are prioritized, the hospital will attract additional patients. Adjustments based on patient census. However, some adjustments were made to ensure that the required personnel level was achieved. The above was done to adhere to healthcare's fiscal standards. Certain resources were in short supply, while others were abundant, demanding modifications. Connecting with essential stakeholders and educating nursing units about the project was critical. The nurse units received instruction on float and trip, as well as information on how to delegate support and RNs. Another issue was nurse inadequacy, making it difficult for nurses to manage their workloads. This created inconsistency in the staff's teamwork, which caused management concern. A budget adjustment was required, and the addition of extra nurses thus increasing the cost of operating. Nurses were added to reduce the workload, which resulted in the organization attaining remarkable success. These were some of the modifications done to accomplish the objective. Despite the benefits of the staffing matrix, better planning, and enhanced workflow, the number of full-time employees increased over the budgeted level. The above scenario affected how healthcare was delivered and created specific fiscal imbalances. The resources were insufficient for the available labor, as there were more FTEs than resources available. As a result, there were more personnel than resources available. Certain nurses could not devote sufficient time to patients, hence raising the payroll bill. There was a requirement to initiate some measures aimed at resolving the problem. We choose to implement a punishment that will assist in reducing the workforce. The required number of nurses had been exceeded, necessitating a reduction. This is one strategy to employ to maintain the intended balance in healthcare. Reallocation of resources based on variance. Patients' demands and groupings frequently change, therefore, adequate personnel levels may not be maintained. Some nurses were laid off, resulting in a reduction in expenditures that can be used to procure high-quality resources. A thorough investigation of the healthcare workflow is required before this can be implemented successfully. I conducted a standard round of audits and rounding before letting go of a few employees to save money. The acquisition of more medical equipment will allow for the proper functioning of healthcare, resulting in better patient care. This shift will be increased, and some of the FTEs will be assigned to this position. As a result, healthcare costs will be reduced, and revenues will be more evenly distributed. Conclusion. In conclusion, it is critical to use the personnel matrix and reflect on the organization's performance. As a result, the organization can better achieve its objectives and avoid unnecessary misunderstandings. There is no waste of time or human resources. One of the most important things to keep in mind while planning an event is managing your time, which was done successfully. As a result, the business runs well, and everyone feels at ease at work. There is no underutilization because the matrix specifies the number of FTEs needed. The matrix prevents resource and human resource duplication, allowing for more efficient use of available resources. The healthcare industry has seen considerable success thanks to implementing the matrix. This essay on staffing matrix in healthcare setting was written and submitted by a student just like you. The IvyPanda Samples database hosts thousands of works similar to this one on various subjects. Visit ivypanda.com to find what you are looking for.